How to clear sinus and lung mucus using salt. If you're constantly dealing with sinus pressure, post-nasal drip, or chest congestion, this video could change everything for you. Because salt, yes, simple salt, might be the missing weapon your sinuses are begging for. But there's a catch. If you use the wrong type of salt, it can actually burn your sinuses and make things worse. So stay with me, because I'm going to explain exactly how this works and how to do it safely. First, let's clear up a big misunderstanding. Mucus is not the problem. Mucus is actually your body's defense strategy. When your body senses bacteria, mold, allergens, or other irritants in the respiratory tract, it produces mucus to trap them and move them out. That's a normal immune response. The problem starts when mucus becomes too thick or sticky and gets trapped deep in the sinuses or lungs. That's when congestion becomes chronic, breathing gets harder, and sleep quality drops. Sometimes even leading to mouth breathing or sleep apnea. Why suppressing mucus makes things worse. Many people try to dry up mucus with medications. But suppressing mucus doesn't remove the cause, it often pushes the problem deeper. And antibiotics are often overused here. Antibiotics only kill bacteria. They do nothing for mold, fungus, or viruses. In fact, they can wipe out beneficial bacteria that normally keep fungus under control, which is why fungal sinus issues often appear after antibiotic use. What's really happening inside your sinuses? Inside your sinuses are tiny hair-like structures called cilia. Their job is to act like a conveyor belt, moving mucus and debris out of your respiratory system. When inflammation causes the mucous membranes to swell and the mucus thickens, the cilia can't move. Everything gets stuck. And that's when sinus problems become chronic. This is where salt comes in. Salt works in three powerful ways. First, salt creates an osmotic effect. That means it pulls water out of bacteria. Second, salt naturally destroys microbes like yeast, mold, and bacteria. Third, salt has a mucolytic effect. It thins and breaks down mucus so it can move out of your body more easily. That's why high-quality sea salt is one of the most effective natural tools for clearing sinus and lung mucus. But not all salt is the same. Do not use regular table salt. It often contains additives that irritate the sinuses. Use a high-quality sea salt, such as Himalayan salt, for best results. How to use salt to clear your sinuses. Method 1: Neti pot rinse. This is one of the most effective ways to clear congestion. Use warm distilled water, about the temperature of bath water. Add 1/4 to 1/2 teaspoon of Himalayan sea salt per cup of water. Tilt your head, insert the spout, and let the water flow through. Keep your mouth open and breathe calmly. Gently blow your nose and repeat on the other side. This flushes out mucus, allergens, and microbes while soothing inflamed tissue. Method 2: Garlic oil, optional for chronic or severe cases. Garlic is one of nature's strongest antimicrobials. Place a few drops of garlic oil on a Q-tip. Gently apply just inside each nostril. Garlic has powerful antiviral, antifungal, anti-yeast, and anti-mold properties. Method 3: Salt steam inhalation. Boil a pot of water. Add 1 tablespoon of sea salt. Place a towel over your head and slowly inhale the steam. The salty vapor helps loosen thick mucus and open the sinuses. Don't ignore the root causes. If your sinus issues keep coming back, check your environment. Mold exposure, especially from basements, water damage, or dirty air vents, is a very common hidden trigger. Food can also play a role. Many people produce more mucus from dairy, and refined sugar feeds mold and fungus. Vitamin D matters more than you think. Vitamin D is critical for immune health, especially for people with recurring sinus or lung issues. If you found this helpful, make sure to like the video, subscribe to the channel.